Hello, everybody. I know I should be moving around, but what I want to inform you about today is I just recently had done myself, so I'm not going to be very mobile right now. So, have you ever woke up from sleep or taken a nap and your knees just don't feel right? Or have you ever been driving a really long time and your knee starts twitching and having immense pain? So, what do? You go to the doctor, you get your x rays, you get your MRI, and only to find out that you have degenerative arthritis. So they tell you that you're too young for a knee replacement and you're stuck with medication and pain until you're old enough for that replacement. But what I want to tell you is there is an alternative to this, and it's called a MACI procedure. So what is a MACI, and what are the benefits of that procedure? Well, after the doctor and the x-rays and the MRIs, you find out about this procedure and what it can do for you. But just what is that procedure and how will it help? Well, I can tell you all about this because I've done some of the research and I had the procedure done myself just recently. Some of the main points I want to talk about is the meaning of the acronym MACI, the definition of a MACI, and some of the benefits. The first main point is going to be the acronym. Now, we all know there's 1,000 acronyms out there, and they all mean different things. And some people even call an acronym two different things. But first, Dr. Eric J. Strauss of NYU Langone Orthopedic Hospital defines it as matrix-induced autologous chondrocyte implantation. Pretty lengthy. And Patrick Keefe said in a Healthline in October 2018 article says it's membrane-induced autologous chondrocyte implantation. So as you can see, there's one acronym with two different meanings, but they both mean the same thing. One is just membrane, one is matrix. The next main point I want to talk about is the definition of a MACI. So in my own words, since I've gone through it, what they do is they'll go in, they'll debrief your knee, they'll clean it up, and they'll take a sample, some of your cells from your cartilage. Then they'll send that cartilage off to a laboratory where they'll grow it. And just before that cartilage is fully developed, they'll schedule your procedure. And after that procedure, or in that procedure, what they do is they'll scrape down the affected areas to where that draws out fresh blood. And they'll put that implant in there, in that affected area. And they'll either glue it or sew it to the bone. And with that fresh blood, does that membrane, it stimulates it for growth. And what I got here is, you can see in some of these pictures, that's the initial phase of it where they're cleaning the area up and getting it ready. This next one, which is part of the same thing where they're still cleaning the area up, but what I want you to look at is in these bottom ones, you might be able to see the red affected area of my knee on this one right here. But this one over here is where they're taking the sample of the cells to send off to have grown. That part of the procedure is not painful. The painful part is after the procedure is done. But the FDA, in a 2016 article, says it's an autologous culture chondrocytes on porcine collagen membrane for the repair of symptomatic full-thickness cartilage defects on the knee of adult patients. It's a pretty lengthy definition and doesn't really describe anything. But Dr. Strauss, he simply defines it as using your own harvested cartilage to repair the knee, which is shorter than what I even told you, and it's less complicated. But all in all, what it really is they're just harvesting your own cells for an implant of your knee. The next main point is some of the advantages. Now, in my opinion, the advantages is it's going to prolong from having to have a knee replacement from a certain condition, which nobody will know until after a few years and some more MRIs from the orthopedics, but that's later to be discussed and figured out. However, Dr. Travis Burns, who is a board-certified orthopedic surgeon with Ortho San Antonio in San Antonio, Texas, says the benefit is that the cartilage cells are taken from the patient's own body, hence is the reduced risk of the graft being rejected, which that's what we really want. Nobody wants to have a procedure done and your body reject it, because you're subjecting yourself to more procedures or more complications. And again, which Dr. Strauss, he says the advantages is, and he shortens it really short, is that it may further stimulate growth of more cartilage, which that's really what it does. Because using your own cells for the own implantation and regrowth and to repair a condition, that's really what you want. You want your body to produce its own cells and cartilage to make yourself better. So in closing, so what is a MACI and what is the procedure? And I discussed what it is, what the acronym MACI is, and the definition of the MACI and some of the benefits of that procedure. But we discussed just a tip of what a MACI is and some of the advantages of it. For me, it has prolonged me from having to get a knee replacement. And I hope that if you find yourself in this situation where this is needed, it has informed you enough to discuss this with your orthopedic doctor. And if it's a good fit for you, unless you just want that knee replacement and never be active again. But with that being said, I look forward to your comments and your critiques. Thank you.